My thanks to the Indus Foundation for having me over. This is actually the second time. I did participate in the one in Hyderabad as well. And good to see you, sir, Shri Agarwal, Shri Ara, respected dignitaries. Permit me to begin with a quote from the Honorable Prime Minister that I think sums up why we are all here. If China is like a manufacturing capital of the world, India should become the human resource capital of the world. That should be our target, and we should lay emphasis on that. 15 July 2015 at the launch of the Skill India mission. I think all of us know about India's young population, the fact that over the next few years, we have the distinct possibility of skilling people, so much so that we can have a plus 50 million, which means surplus 50 million for the rest of the world, whilst the rest of the world with its aging population will be deficient to that tune. It's a challenging task. The numbers that were put up before speak for themselves. At 3.7% formally skilled people, India stands at the bottom of the rung, with countries like Korea having 97% formally skilled, and those between China, Japan, West Europe, United States being between 50 to 97%, which means 1 in every 2, or every individual working in these countries, the leading countries of the world, is formally skilled. That does not imply that we have only 1 in 25 skilled. It implies they are not formally skilled. They have acquired the skills, a lot of them, whilst OJT or on-the-job training. So the Skill India mission basically has dual objectives. One, and the more obvious, to build a reservoir of skilled people. The second, not so obvious, is to do an analysis and to certify those working, the ones that meet the standards, to certify them as skilled, and the ones that fall short, to help them bridge the gap so that they can become fully skilled as well. In the process, through these dual channels, to build a reservoir of sufficient numbers in quantity and quality so that the country can meet its desired objectives. I represent the Life Sciences Council, one of the many that's been set up under the Skill India mission. And under the broad umbrella of the Ministry of Skill Development and Entrepreneurship, and we have Shri Rajesh Agarwal here, Joint Secretary. And our objective, that of the Skill Council focusing on life sciences, is to develop a skilled workforce for pharmaceuticals, biotechnology, and clinical research. Now, these subsectors, what demarcates them from other sectors or subsectors, most crucially, is that high quality or poor quality impacts not revenue, it impacts human life. The stress, therefore, must, in our view, be always on quality as opposed to sheer numbers. And that's what we are striving to do. We started with a study that revealed that this sector has as many as 240 distinct job roles. However, it turned out to be a very skewed distribution, with just 60 taking up 90% of the job volume of 800,000 that are employed in this sector today. Even more crucially, just 10 take up 50% of the job volume. We have therefore, over the course of the last 2.5 years, since inception, developed what are known in certainly the skilling parlance, national occupation standards, which define the skill sets, both hard and soft skills required of the workforce to do a satisfactory job, to do a capable job, and then, having laid the foundation through these national standards, to set up a skilling ecosystem whereby a more job-ready workforce can contribute effectively to the growth of this vital sector, a sector that's growing, by the way, at 15% a year, which means doubling every 5 years. Over the course of the last 2 to 3 years, ladies and gentlemen, we have focused on the major clusters of pharma activity, 5 of them that take up 65 to 70% of the job volume. And we have successfully brought together industry together with our training partners so that the practical training can be imparted either on the shop floor or in the lab. Because a person can be classified as skilled only if sufficient practical training is imparted. 3 or 4 of these clusters are already covered, and the balance 3 to 4 we expect to start skilling activity very quickly. A couple of things that I'd like to mention which we are very strongly focused on, and those are IIC. We just happen to be here, it's a sheer coincidence. But the IIC that I refer to are inclusivity, industry connect, and convergence with our line ministry. Inclusivity. From the very beginning, knowing how dispersed this sector is, how diverse it is in terms of size, in terms of subsectors, and importantly, in terms of origin. So we had large and small, we have, that's by size. We have by subsectors, pharmaceuticals, biotechnology, clinical research, and we have by origin, which is Indian and multinational. And I believe that there has been no forum except ours where the 10 associations, I repeat, no forum except ours where 10 associations have stood together, come together, jointly agreeing that this is indeed a crucial task. There have been tugs and pulls in terms of pricing, IPR that pull them apart. This is the one area, the one initiative that binds them together. We have therefore today all 10 associations that count, that are active in the 3 subsectors, with in each case, or in most cases, headed by an industrialist, and with them and through them, we have, and we've mapped this, cover 98% of the revenue and, importantly, the job volume of this sector. And therefore, we have the vital connect to small, large, and medium organizations. Secondly, industry connect. Leveraging these associations, we have had participation from industry in very vital areas, not just of laying down the national standards or the national occupation standards, but in building a pool of master trainers who are involved in the Train the Trainer program. In RPL, recognition of prior learning, I mentioned about the vital need to certify those who are skilled and meet the standards. and importantly, in involving industry, prominent organizations in practical training and hiring of candidates. And today, most of the top 30 organizations have hired a couple of people who are certified by the council. And I think that's testimony to the fact that the model is working. Finally, the convergence with the line ministry. That we believed right from the beginning it was very important, and it took us time to work with our line ministry, the Ministry of Health and Family Welfare, the DCGI, and when they saw the model that we had set up, the standards that we had set up, we have found very strong support and convergence. And today we are the only skill council where the line ministry has actually put out a circular urging industry to hire those certified by the council and to have their workforce assessed and certified. So I believe that we have now a system that's well geared to take, at least in our sector, bring it the scale and speed that it deserves. I'd like to conclude by saying that the mission that's being moved forward under the overarching umbrella of MSDE has never been attempted before, and certainly never on the size and the scale in any country of the world. We are playing catch up, and as the Honorable Prime Minister said, something that should have been done some 68 or 69 years ago, there is no better time than to do it now.